Hey, everybody, I'm WPTV anchor Chris Gilmore here on Tuesday, March 30th. Happens to be National Doctors Day here in the U.S. And joining me, we have a treat for you, doctors from our area. I want to just go ahead and go down the line and introduce them. We have Dr. Daxa Patel, an OBGYN from our area. Thank you for joining us, doctor. And the doctors keep coming with Dr. Luis Pena Hernandez, a pulmonologist here in our area, and Dr. Ramprasad Gopalan, a infectious disease specialist from Palm Beach County. Thank you all for joining us. I know you have terribly busy schedules. Appointments are hard to come by for patients and doctors. I know that, but I want to be the first to say Happy Doctors Day to you all. I want to thank you for being the frontline heroes for the past year and even beyond that. And definitely some of the hardest working people, long days, longer nights, and days off are hard to come by, I'm sure. While I have everyone's attention, including our online and live audience, I want to encourage you guys to go ahead and shout out your thank yous or words of appreciation or any questions you might have about these doctors that they go through on their day-to-day. Obviously, they've been hands deep in this COVID-19 pandemic in different ways, and we'd like to get a sense of what that's been like. What has life been like professionally and personally for you all for the past year? And I want to start with you ladies first, Dr. Daxa Patel, as an OBGYN. I know that was kind of the first signs that we've seen in the child delivery. One of the main aspects that we've seen change from a parent's perspective. We've had lots of my colleagues who, became pregnant over the course of the pandemic and have been telling me their stories about how, they had to cancel their parents' flights. It was usually a big family event to, have the close family union around them during this, very sensitive time in their lives, bringing a new child into the world. But that all changed. Tell us about some of the changes and precautions that you've had in your field.
Well, I think for me, the biggest change I feel so bad is because all these soon-to-be fathers can't come to their prenatal visits with their wives. They don't get to see their child by ultrasound. They don't get to participate in the prenatal visits. And because we had to restrict people coming into the office, we would only allow the patient in. And sometimes we would try to accommodate them. We would, FaceTime them, let them watch as we do ultrasounds or listen to the baby's heartbeat, because all that's been taken away because of the pandemic. And I don't get to know them until they are there in the delivery room and I meet them for the first time, when this used to be, it's a teamwork, really, being pregnant. I think the husbands are missing out on a lot. And of course, the patients, the moms, are scared. We have such little information about COVID in pregnancy, and then they're scared to go to the hospital because that's where COVID is, right? And we've had patients who are pregnant who've contracted COVID during the pregnancy.
And how scary is that? You're not only worrying about your health, but your unborn child.
Yes, and we had such little information about what's going to happen to the baby after the baby's born. Will the baby be born with COVID? And it's still a learning process.
That's an interesting point. We actually have a story running tonight on WPTV about a mother who, while pregnant, received a vaccine, right, and her baby was born with antibodies. So that's another big judgment that parents have to deal with, to vaccinate or not to vaccinate while pregnant. It's kind of unexplored territory.
Right. And we are now encouraging especially frontline workers who are pregnant to go ahead and get vaccinated even during pregnancy. Because
that brings in another interesting point that I can bring in the rest of the doctors in on this. How reassured are you now in putting yourselves on the front lines now that the vaccines have been made available, as you guys being a priority group? I assume all of you guys have at least looked into vaccinations?
Yes. We're vaccinated.
We're all vaccinated. Yes.
How crucial was that for you guys in terms of being confident in the work you do and getting up and going to work every day? I'm sure it must be some relief.
Well, to starting from the very first patient that walked into the Palm Beach County to now, we are doing our work diligently. We have to do our protection, wearing PPE. yes, vaccination is a bonus, but nothing has changed. The way we still enter the room, exit the room, the personal protection. From day zero till now, we are still wearing masks, and taking precautions in spite of vaccination, because that is the recommendation, because there are many variants in there. But again, we can't just walk in, walk out.
And Dr. Gopal, I feel like a lot of South Floridians need to hear this, that just because you're vaccinated, that does not mean that you are bulletproof or there's like a magical shield of armor around you. You still need to take those proper precautions.
Correct. There are certain CDC recommendation in a group of people who are all vaccinated. Every one of them are vaccinated. There is, if you are in an indoor gathering, there are certain leeways, these days have come up. But when you're outside, you don't know who is vaccinated, who's not, and what kind of variant they're bringing. South Florida is a cosmopolitan city. We get people from all over pretty much the world. And, there is a slight bump in the number just in the last few days, I'm in the forefront of that, so I can gauge the pulse of what's going on, locally. And so with that, slight bump, because we never came down to low normal. We are at a high plateau. As if you ever heard the word high plateau, that means the number is still high, although trending down. If you let your guard down, it'll spike right up, as happened in Europe. You see they went back to a second closure because they let the guard down. This is not the time to let them.
Recently, we even saw a state of emergency down in Miami because of the large crowd gatherings and things like that.
See, that again goes back to the psyche. Oh, I'm immunized, or saying, hey, it doesn't bother me. Same thing holds good. It may not bother you, but when you go home to your parents, your grandparents, they will end up in ICU if they get sick. So it is the greater good. Still, till the herd immunity kicks in, we're not there yet. We are looking at that point. I think by mid-April, we're trying to get 18 and older immunized. So we are working diligently to get the immunization status to the point of herd immunity. And then we have to worry about the little variants and all later on. But once you get herd immunity, so I think till then, follow the safe precautions as we are. This is not the time really to let the guard down. We are inching towards progress. So keep the mask on.
Be smart. Yeah.
Just be a good citizen. It is not me, you, just everybody. We live in a common space. Again, as I say, the common space belongs to everybody. Unless you're in the middle of the jungle, 50 acres in the middle, do what you want to do. But when you're in a common man, we're good.
Yeah. Thank you so much for that insight. And I am seeing all the comments of appreciation and wishing you all happy Doctor's Day. I do see an interesting question here from Maggie. She's asking if a family member is vaccinated and has proof, can they be present in doctor's visits as the second parent in a child visit? I don't know if that's a question for you, Dr. Patel, or I don't know if it's different for OBGYNs versus different doctors' offices, what the protocol is.
Well, yeah, I think it depends on the doctor's office, but even if you are vaccinated, you can still infect somebody. So for that reasons, we are very cautious because we have to protect the rest of our pregnant patients. And I'm sure the pediatrician's office, I'm assuming she's asking for a younger child because we see adults. So that would be up to the individual pediatrician's office.
Well, here's a question for all of you, just out of my curiosity. These vaccines are something that became widely available even for frontline workers this year. You went a whole, almost full year prior to this, though, going to work every day, being exposed on different levels to patients who were positive. And despite PPE, I'm sure there was a big concern of, hey, I don't want to bring this home to my family. What precautions did you take? I know a lot of you are parents or, are close with your families. And I'm sure they were worried about, hey, I don't want to not see my husband or my father or my mom or wife when I come home. How did you battle that?
Well, and I'm glad you bring it up, Chris, because you're absolutely right. It's not only the responsibility of getting vaccinated for our own protection, but as healthcare workers and as members of the society, we have to keep in mind that we come home to our families and we have people that who surrounds us, like Dr. Gopalan says. We don't live isolated. So we have the responsibility to protect others around us. So when you ask that question, did you get vaccinated? And I personally did, and I did it on a clinical trial ahead of many other people. But I did it with the complete conviction that I was not only protecting myself, but also protecting my patients and my family. When you come home, you have, I have minor children, and I have a wife, and you have the responsibility to protect those who surround you. And even though we use PPE and we try to keep our guard up, as Dr. Gopalan says, the risk is never zero. People have to keep in mind that even though if you get a vaccine, let's say if it's a 95% effective, there is still a 5% chance that you might be, able to get the infection. You might not get it as severe as the person who was not vaccinated, but you can still transmit it. So it's a matter of not keeping keeping your guard up and not letting it loose.
Well, when it started, the start of the pandemic, I used to, keep separate cars, stay out, never came in contact with the kids. I just head straight to the, shower, take off, things, kept separate cars, we kept it, things which there was a lot of unknowns. So we try to protect our family that way. And especially at the beginning of this, I've seen lots, and by now I've seen thousands of patients, So with that, there are days in the height of the thing, we used to see morning till evening, as we say, we worked all day, working all day.
You, Dr. Gopalan, and Dr. Pena, you have interesting perspectives, and this is just touching a little bit on your personal lives. But I know, Dr. Gopalan, you have 2 middle school age children who, for the longest were part of that, low risk factor. But Dr. Pena, congratulations, you have a 10-month-old, Sophia. How concerning was that for you? That you're bringing a child into this world and into a pandemic, which something on this scale had to happen since more than 100 years ago. We're talking Spanish flu. So this must have thrown you for a whirl. You haven't dealt with anything like this in your professional career, or as a dad. There's no instruction manual for this.
It was very challenging, especially at the beginning. My wife was pregnant, and the whole pandemic started, and of course there were concerns and significant concerns regarding going to work. And so me and many other of my colleagues would come to work, and you come to the garage of your home and you pretty much strip yourself down, go to the shower, and try to get as clean as possible, try to use the PPE, try not to expose your family as much as you can, because it is a risk, and like Dr. Patel was mentioning, there are unknowns, and now we are learning more about this condition. But throughout this whole process, it has been a learning curve, and there's been many questions that have not been answered, and little by little we have reached some level of understanding. But I still think there are unknowns, and there is still ground to be worked on. So, yeah, it was challenging. But yeah, little Sophia is doing good. Thank God, she's 10 months old, and she's healthy.
Daughter of a fighter. There we go.
Right.
And Dr. Gopalan, I was talking about this before the live stream started with you, but believe it or not, for everyone watching, this man has not had a day off in over a year. You talk about work-life, personal life balance. I guess that went out the window for you this year?
Yeah, this year was pretty unique in the sense, we worked 2 places with that. I basically had no days off. That's pretty much, what I had to do. But, it kept going, playing with the emotion, I kept on with it. I think it's hitting that wall right now because, we had a little lull. So I'm praying people will support us, all of us, who have worked hard, hard. So to keep this at bay, so at the end of the year, or maybe beginning of next year, we may enjoy a little bit of life, so-called a new normalcy. I don't think it will ever go back to what we were before. I had an analogy, like if you ever traveled before September 11th, you just could walk into a flight, international flight 10 minutes before you could. Try that now. You have 3 hours before the flight. So that's a new normal for travel. And hence, we're going to have a new normal for life around us. And slowly, as we acquire immunity, either by infection or by vaccination, hopefully all by vaccination, things will turn around, slowly. But till then, don't let your guard down. Help us all out so that we can just take a breather, every now and then.
Yeah, because COVID fatigue is real. I can tell you that. But it's not time to let the guard down.
Correct, because especially I've had days where I have a few hours of sleep, a lot of those days, and wake up and it's right there, and you go back, and then sometimes you got to go multiple times because they need some treatment, so you got to see them, and then it is not as easy as going in and coming out. The getting ready to don and off will take time. All those masks wearing, changing, doing that, it takes a lot of time. So it's not just going in and out. So please wear your PPE still, even if you're vaccinated.
Dr. Patel, this one's for you. I'm seeing all the appreciation and some questions coming through. We'll get to those in a little bit, but I'm sure you've heard throughout this past year, people refer to all of you as frontline heroes. But this is something that you've been trained to do. You went to school for. You've been doing most of your, if not all of your professional lives. Is it weird to be called a hero, especially in this pandemic age?
Yeah, because we're doing what we love to do. We didn't choose this profession for that title. You have to love what you do. And I think as long as we keep doing that, and our priorities will always be our patients. And sometimes our own families have to take a little bit of a backseat, and they have understood that. And but this year was very different. It was very different. And for us, especially in OB now, we jokingly we're delivering what we call the lockdown babies, because 9 months ago there was nothing to do. So we're seeing a little surge in the babies since December, January, February.
Yeah, a little bit of a baby boom.
Yeah.
So Dr. Hernandez is blushing over there.
But there's some joy, and that helps keep you going, because we need that right now. We do.
Oh yeah. And I mean, let's talk about. We have a quick question here from Nagy. If a child tested positive with COVID, how long will they have antibodies? And is it any different from an adult and them having antibodies?
I mean, as of now, I don't think there is any difference, because a lot of things need to be elucidated, including how one person who's 29-year-old is deathly sick and succumb to the disease, whereas 100-year-old have sent them home. There are a lot of things, nuances of immune system, immune interaction, in play. So we have to understand this disease in depth about how certain people are so susceptible and certain are not. There are certain countries where they thought it will sweep through the countries. Like, for example, India, there are certain areas where we thought, the slum, it will devastate the whole thing. It did not. There was some of the logic behind that is these people have innate immunity. What it means is they've seen so much of infection, the body is ready to fight. They are natural born fighters, so they are ready to fight. So that's where their immunity comes from. As to specifically answer the question about child, true answer, don't know. Nobody knows that. But to extrapolate, the data is what we have right now. At least 4 to 6 months should be okay. But there are other SARS-CoV-2, SARS virus, which other than COVID-2, which you take notes of, like MERS, they get vaccinated every year, so the immunity wanes after a year. Do they have anything like a cell-mediated immunity? In this particular one, need to be elucidated future.
Okay. Now, just a general question for all of you. Just last March, April to now, here we are in April in a couple days of 2021. What's been the hardest part about this for you guys in battling the pandemic, these long work days, and I'm sure a lot of sleepless nights worrying about your patients?
I will tell you without any doubt, the hardest part is when you have couples who are in the hospital and one of them is not doing well and the other one is doing okay. And then the poor wife is asking, how is my husband doing? And they're not doing well, and you have to give them updates. And it's very, very hard. It touches a very human fiber from anyone, the healthcare workers, then everyone in the hospital, the nurses, and you have to face that person because you are their main line of communication and you are their main source of information from their loved ones. And sometimes the outcomes are not good, and it's very hard because you have to tell them, your husband was just intubated and they're in the ICU, and they are sick themselves, and these are families, entire families who sometimes are in the hospital. So that's why when people tell me, and I haven't the utmost respect for people who have fear of vaccination, but I tell them you have to make a decision. Either you are going to be exposed to a potentially lethal virus, or you are going to take a vaccine, which even though it's relatively new, but it's proven to be safe. So I think that's been one of the hardest parts when you deal with family members and entire families who are ill, and you see them struggle over their loved ones being also ill, and sometimes even passing away. So that's been the hardest part.
Right. I think at the U.S. we're right at 546,000 deaths right now, and a lot of them here in Palm Beach County. So it's a reality, unfortunately.
Yeah, I agree with Dr. Pena. Go ahead.
I wholeheartedly agree. One thing that has touched me is having lost colleagues to COVID. And I remember in the beginning, one of the physicians who trained me down at University of Miami, we had a Zoom funeral for him. And, that really hits close to home too, because these are fellow physicians doing their jobs, and they succumb to the disease as well. That was very challenging.
Yeah, that's true. Including some of their own colleagues, like one of my ex-partners who was in Arizona, who was sick. He's young and vibrant in the 30s, and he has no other comorbidity. He himself was sick almost as 5 months, and he was 5 weeks in the hospital. He's a young, vibrant doctor, an ID doctor who was doing what he was doing, trying to help and take care of patients. And he was down for the count for almost 5 months. So that's a reality. That's a true reality. People need to understand when, especially say it's my right, your right. It's a universal space right. So we all even now, please.
We are at more than 30 million cases, and it seems like if you haven't had it, somebody who has had it. So it gets really real in that sense, for sure. Dr. Pena Hernandez, you were talking about it earlier, about how you respect people who don't want the vaccine. How do you, doctors in general, address that when you hear your patients say that they absolutely don't want it, or they're hesitant?
Unfortunately, this is becoming like a somewhat of a political debate, which it should never be. But in reality, I think confrontation does not lead to any good result. So the way I do it is I listen to the patients' concerns, and I address them in a calm manner, and I explain to them what happens when they get the vaccine, and I try to put their fears to rest and explain to them that this is a safe intervention, and recommend them to do it. And if they still say that they don't want to take it, then I encourage them to think about it and address it at a later time.
That's a very, very valid point. There are very specific fears of patients, what I call. Example, young females who are of childbearing age. I say, oh, well, I've heard, there will be a fetal issue, or when I get there is nothing. It's you got to explain to them what's an mRNA. How does RNA differ from, DNA? In the simplistic terms, how it does not affect them. So you got to listen to the individual fear and allay the fear with a scientific fact and tell them, I have taken, so it's a lot of people. So you encourage them and you show them compassion and data. You work with, as Dr. Pena was saying, their fears and their concerns. And then once you put most of them to rest, and say, I've taken it right here. I'm standing in front of you. I'm good. So I think majority of them will take it, but there are some who are. Then they are responsible for their own protection, wearing PPE. This is not a communist state or any other state, so you cannot mandate anybody to do everything. So although sometimes for the greater good of the community, you say, oh, I cannot be excluded from here and there. Well, in the society, you got to conform to certain norms. Like, there is no your right. The whole form of society is everybody live in a space. So people understand that, respect everybody. There is no individual rights in there. That's my thing. So keep everybody safe.
Here's another question that just came to mind. What's it been like to see minority communities being affected harder by this pandemic as opposed to other populations for reasons of comorbidities or insurance coverage or proximity to a hospital?
No, I think we are seeing a mix of everybody. The association, you're seeing with the minority population, yes, there are majority, many of those broken down things, the whole thing about, many people living together, they have to go out to work, they're still getting exposed. All those still exist. But insurance does not matter because I think the COVID is covered by the state. I don't think because you walk into the hospital, you get treated regardless of if you really need treatment, nobody's going to send you out. Any of the hospitals, I've never seen it will not happen. You're sick, and as far as I'm concerned, you will get treated, whether you're, to the fullest extent available to anybody, So that's not the concern. But yes, the same factors, socioeconomic factors, play as with any disease. Why it affects just COVID in itself is not because the most of the people they're working. They're still in a close proximity, and their work may not allow them sometimes to protect themselves, or inadvertently they come in contact. So then, so they keep on going and they go home, and the next thing is they propagate the whole house. So that's one thing. But in here, we see all across everybody, all across the general population, as I call it, everybody. There is no one specific skew. There was a time there was a little skew in the middle, but now it's just general population. What do you see, Dr. Penny?
Yeah, I see a mix of the general population as well. I've seen groups who, due to their socioeconomic structure, for example, Latin American families who tend to, live together with their parents or grandparents and larger family groups, then they tend to expose themselves a little more than others. But in reality, I agree. We've seen people getting sick all across the board. And like Dr. Gopalan says, the access to healthcare in that regards has been completely unrestricted. And I think in that sense, we are in a better place than many others in different countries and different other states. But I think, this is something we've seen who pretty much has affected the general population as a whole.
Yeah, anyone from people like me to your colleagues, as you were mentioning earlier. With that in mind, just with all the risks that you guys are obviously taking, even more so this year in your professions in terms of exposure, what keeps you coming back to work every day?
It's the goo. It's the thing what we signed up for. Plus, we can say that I don't think we've ever. This is another disease among the million, things we do. This is also one of them. We started, from the get-go. We are it for them. So, our patients are there. Our concern. The day you don't like to do that, please hang your hat up, and then you're done from it. Even today, that's what drives you to get back to work. Trying to do what we're trained to do. And that's pretty much there. Other than that, there's no fear. There's no place for fear. There is no place for anything else other than pure science. Protect yourself as much as you are. protecting. And nowadays you do have a modality of protecting yourself with vaccination, PPE. Then down the lane you do need to help people who you signed up to help. So that's that.
Absolutely. Absolutely.
It's part of the job, what you signed up for, like you said. Now, everyone watching here, I'm drawn into the conversation. I almost forgot about the comments, but we are watching the comments section. If you have any questions for these physicians, or if you just want to tell them a big thank you, today's the day to do it. Not that they don't deserve the thanks every other day out of the year. Today is National Doctors Day. Have any of you doctors in your jobs today, have anyone come up and wish you a happy Doctors Day in person?
All the hospitals, they had a little get together. I was there at Palms West. They had a good lunch and breakfast, and thank you. And I think every hospital is doing a little thing for the doctors. And then I mean, it's nice, but then again we go on to the next one and the next one, and then thank you all.
Yeah, the appreciation and all the thanks must be pretty humbling, but also the little push that you might need, especially in the middle of the week, to get past that slump, to just push you on to the next appointment or patient.
Yeah, no, we are very thankful because it's very nice to feel acknowledged. But like Dr. Gopalan said, we do this with our heart. This is our passion, our lifestyle, and this is our life.
Absolutely.
Now with that, as we're winding down here, and anything you want to say to your patients that are holding you all in such high esteem, you giving them a reason to celebrate today?
Thank you for the trust. Thank you for, counting on us, and for all the expression of, acknowledgement. And we get expressions of love on a regular basis from our patients, even though it's a hard landscape to work in this day and age for multiple reasons. People are stressed out, etc. I still feel that there is enough appreciation out there. So thank you very much.
Oh, you're getting a personal shout out from Pam Peterson Casey, who says that they worked with you, Dr. Pena and Dr. Gopalan. I don't know if you recall them personally, but they're watching and they appreciate you as well, former colleagues of yours.
Thank you.
So you must get a big sense, especially after a year like this, seeing so many patients, of just how big your reach is. And I don't know if you get, things that are like, hey, I saw you, you saw me a couple months ago, or even walking down the aisle at Publix. Thank you for your great service, or something like that. It must be pretty humbling.
Yes, in our part of life, in each and one of us, this is what we're doing throughout the decades of this. We help them, and then we do go through this cycle. But again, if one thing I can tell to everybody is, well, get immunized as soon as your turn is up, and wear your mask. Still help the society as a whole. Please wear your mask. Help the society. We need to get over this one and get back to at least a new sense of normalcy. That is my one request, and I really thank you all for that one too.
Now, Dr. Gopalan, is this your son? Nikhil here?
Yes, it is.
On Facebook? It's okay. It's after school, so he can be on social media.
Yeah, he's out. He's on his way back. Yeah.
And, Debbie as well, right below him, saying Happy Doctor's Day. What a surprise that is. What do you tell your kids, Dr. Gopalan, about what you're doing? I guess they still think your job is cool if they're saying thank you on the Happy Doctor's Day.
Yes, they do. They see me, like, don't touch me. I'm coming from the hospital. I gotta, they know, not to get in one of the cars, or not to, I come in, I have a routine, what I follow. So they are well versed with it. And then, when I come in, they know, oh, you just came back from, sometime I go see the COVID patients. So, are you coming back from COVID patients? So I say yes. And then they say, okay, I go take my routine shower, change. As Dr. Pena was saying, there is a whole area of stripping. Yeah. And it all goes in before you get into the house. And, the shoe stays out, a whole different things. We have a whole routine we have maintained. So that's still ongoing. And then, that's the thing. And my kids already know all that,
Yeah, I'm sure it's special when you hear the things from your patients, but your family really has got to be your biggest cheerleaders through all this.
Yes, I love them to death. Yes.
Okay. And what about you, Dr. Patel? You're sending home new parents, almost every week or so, I'm sure. At your
Daily?
office.
Let's say
Daily?
babies daily. Absolutely. So that, that's our ray of sunshine, although they're still very scared, obviously, but I do miss seeing the babies visiting back with their moms when they come back in the office because, again, precautions. But I've had patients, I delivered their babies, those babies grew up, and the babies have become my patients. Or I delivered
yourself there, Dr. Patel. Done it yourself.
Yeah. So, yeah.
You've been doing it for a while.
Yes. Yeah.
Anyway.
A long while.
All right. Well, from our WPTV WFLX family, we want to thank you all so much on this National Doctors Day. We have a lot to be grateful for. You guys, again, all of you in your work uniforms right now, taking time out of your work day. I'm sure you're going straight back to patients before you head home, but we want to give you a big thanks, and our viewers as well. You see all the comments here. So we can't be honored enough to have you in our community doing honest work, keeping us safe. So we appreciate that.
Thank you very much.
Appreciate that too. Thank you.
And with that, we'll let you get back to your workday. And thank you all for joining us online as well. We appreciate it.
Thank you, Chris.
Thank you.
Thanks.
Bye-bye.